I'm Dr. Marshall Hanson, developer and educator of the Marshall Hanson Method for non-invasive smile enhancement. It's changing the way our profession thinks about and delivers cosmetic dentistry. This method is so unique and unlike any other procedure that most general dentists are familiar with, that it just can't be mastered in a single weekend course. This is why we've created a 4-week residency program purposed for delivering with confidence the Marshall Hanson Method for non-invasive smile enhancement. The goal of this residency is for you to leave with all the tools necessary to add this powerful treatment option to your practice. Having had the opportunity now to have trained numerous residents in this method, we've already begun to see an increasing number of them providing this level of treatment to their own patients with confidence throughout the United States and abroad. I can't wait for you to hear in their own words how this method and its associated educational program has impacted the scope of their practice, influenced their philosophy of care, and significantly improved their professional satisfaction and the lives of their patients. Here's what Dr. Michael Ahn from Washington had to say about their unique learning experience with us.
My name is Dr. Michael Ahn from Seattle, Washington. I came down to Utah to see Dr. Marshall Hanson about a couple years ago and shadowing for about 3 days. I follow him on Instagram and I love his work. That's why I came down. I've been practicing probably a year and a half, and then I decided I need improvement. So I came down here again and I watched his updated techniques, practiced my technique on typodont. And then I had a live patient, Christine. We did a 9-unit veneer, and I'm really happy with the work. I worked on a total of 3 typodont cases. I had an improvement on each typodont cases. He goes over every typodont cases and what kind of improvement I could have made. When I worked on the first typodont, my biggest mistake was my letter incisors were a little bit bulky on the distal. He went over what's the right angle, how to contour for the letter incisors. So my second typodont, I made a huge improvement on that. I did make mistakes on colors at the incisor edge, so I made a huge improvement on the third typodont. So when I look at my third typodont versus my first typodont, it was pretty of a huge gap of improvement that I made. Working on a real patient and on a typodont was a pretty different experience. Working on a typodont gives you a basic idea of how the method is working. Working on a real patient, as you know as a dentist, is very different. You have to communicate with the patient, talk about the expectations. His method is one of a kind. No dentists are doing this way. First of all, is non-invasive. How it's designed is not to touch the natural tooth structure, having a veneer on top of it without any damage. And secondly, he's using a resin composite. Resin composite can directly bond to the natural tooth structure without any gaps. If there's any gaps, such as conventional porcelain veneers, it creates a little gap for the bacteria to grow, which can be a problem and also can be a problem for the longevity of the veneer. Porcelain veneer is not really designed by a dentist, but resin composite, it's done by a dentist. It's designed by a dentist. The person who's doing it, like Marshall Hanson, he's the one designing how the teeth is going to be and what color is going to be, and he's sculpting it with his own hand. He has control over entire case. That's why I love this technique, and I really have a very high respect toward Dr. Marshall Hanson because he's really excellent at it.
Michael, it was so fun to have you come out and spend a number of weeks with me. I love getting to know you and work with you and see you develop and improve and then have that live case experience with Kristen.
Watching you over the shoulder, I learned a lot. Sometimes I felt like you're just too meticulous. You're going over a step like multiple 100 times here and there and look at same tooth here and there. And I thought I could have make your method a little more efficient and then make it a little shorter and faster. Now I came back here a second time and then I realized why you're doing all these little steps and why it's very important.
I think that's a common response because it is a longer appointment And we're not used to that as dentists. We're used to like the 1 or maybe 2 hour appointments. And so most commonly, doctors will come and watch and be like, there's gotta be a way to do it faster. And what they don't see is the decade of me thinking the same thing. I'm like, how can I make this faster? And trying so many different things, but exactly what you said, my philosophy was it has to be better and not just faster. One thing that's been kind of fun with the residency program is that sometimes I have 2 doctors together. Like we had Dr. June from Australia.
Oh yeah.
That was here with you for part of the week. And I love that. It's fun to see the 2 doctors coming together, sitting side by side, working on the typodonts.
We sit side by side and then we work on our typodont for hours and hours and hours. It kind of create a little bit of a funny competition. It's not, I didn't want to think it as competition. We're here to learn anything, but still it's like I work and he works at the same time, and then we're sitting down and working on the same thing. So I think it gave me a positive impact.
And that's the feedback I've heard, that having just a second doctor there to bounce ideas off of, maybe they ask different questions than you might have thought of, and vice versa, that it creates just a better experience. So I love that you had an opportunity for another doctor from another country to come and go through part of the residency with you. One of the other things I really liked about our time together is seeing you finish Kristen's case, your live patient experience.
Her case was a little challenging case. Christine had a severe gum recession on upper anterior and also lower anterior as well. When we create a smile design, the gum architecting is very important, but the challenge was lateral incisor and the canine. The gingival zenith was actually pretty high. And also she had a little smile cant. Her left side was a little higher than the right side. Her midline was a little bit canted to the left. So those kind of things need to be fixed. So when I first looked at the case, it's gonna be a challenging case, but the case turned out to be really good. It's actually much better than, like I said, it's 1,000 times better than I expected. So I was very happy with the case, and then I think patient was very happy with it as well.
So what are your plans? What are you hoping to do with this moving forward?
I do work in a PPO office. It's a family dentistry. It's like a typical dental office in the United States. In order to profit, then I have to see multiple patients in a limited time. In reality, I have to compromise my quality, which I don't want. The PPO family dentistry business model is a pretty outdated model. I wanted to be a real cosmetic dentist, not like doing cosmetic on the side. So once I go back, I'm going to look at your business model and study your business model, and then work on my marketing, and then how to actually move on to my next step of my my career as a cosmetic dentist. Yes.
What type of advice, having gone through it yourself now, would you offer to other doctors considering a similar path?
If you really love and deep dive in composite resin veneer, then I think this is a right place to start. When you shadow Dr. Marshall Hanson for the first case, it's gonna be a long case. You might feel it's longer than what you first imagined, but you have to focus on what the outcome is. Don't get disappointed by a long procedure or how much effort he puts in. That's what's necessary for the excellent outcome. I think it's going to help a lot if you actually practice on some type of a model. It's either a live patient or a typodont. I think it's going to help a lot.
Yeah, I have seen that it's been good for if people have tried the method on their own in their practice, learned some things, had some experiences, and then they come because they have better insight as to, okay, well, here's what I need to solve, here's what I need to learn, here's what I need to fix. I'm just excited to see all the neat work and patients you're going to impact moving forward.
Thank you, Dr. Hanson. Yeah, for having me for multiple weeks with my wife together.
So good.
Yeah.